All right, well, let's just get started here, and I'm sure people will continue to come in as we go. Matt, would you like to start us off?
Absolutely. Welcome, everybody. I'm just going to run through the guidelines for the meeting. So as you may have noticed, all participants will join the meeting with muted microphones. If you could please rename yourself to include your first name, your last name, and your affiliation should you have one, that would be fantastic. To participate in this discussion, please select the raise hand function. You can find this in a few different places depending on the version of Zoom that you have. It may be on the toolbar at the bottom of your screen. It may be within the reactions button that's also at the bottom of your screen. And if you don't find it in either of those places, then it will likely be under the participants window, which you can also open using the toolbar at the bottom of your screen. If you are calling into this meeting, you can use *9 to raise your hand. And if you have any technical difficulties during this meeting, you can get in touch with me, Matt Archer, via the chat box at marcher@ctps.org or at 857-702-3708. Just going to read the accessibility statement here as well. This meeting is accessible. Sorry, slight screen issue here. Give me one moment here. This meeting is accessible to people with disabilities. Zoom products are compliant with exceptions with the following standards: Web Content Accessibility Guidelines 2.1 Level AA standards and revised Section 508 standards. If you require any accommodations in order to fully participate in this meeting, please contact me, Matt Archer, via the chat box at marcher@ctps.org or at 857-702-3708. And with that, I will pass it back to you, Sandy.
All right, thank you, Matt. So we're just going to do a quick round of introductions. And again, if you have the ability, please rename yourself with your affiliation and your full name in your Zoom display name. Since we have a not a huge crowd, we can go around and do this verbally. I'm just going to introduce myself, and then I'll go around and call on everybody else. My name is Sandy Johnston. I'm a senior transportation planner with the staff to the Boston Region Metropolitan Planning Organization, and I manage the Transit Working Group, which is sponsoring this coffee chat. Matt, you want to go next?
Sure. Thank you, Sandy. I am Matt Archer. I am a transportation planner at the Boston Region MPO.
All right, Betsy.
Hi, everyone. Betsy Harvey. I run the Transportation Equity Program for the Boston Region MPO, including the Coordinated Human Services Transportation Plan.
Thank you, Betsy. Bill McNulty.
Hi, Bill McNulty, Principal Transportation Planner with Old Colony Planning Council.
Thank you. Todd.
Korean Transportation Administrator for the town of Brookline.
All right. Susan.
Susan Barrett, Transportation Manager, Town of Lexington.
Thank you. Lisa.
I can't figure out how. Lisa Weber, Transportation Compliance and Quality Assurance Coordinator for the Human Service Transportation Office.
All right. And Todd's second screen.
Sorry. Vera Corain from the Human Service Transportation Office. Can't figure out how to rename myself. Hang tight.
Thanks, Vera. All right, John Strauss.
Hi, John Strauss from the town of Burlington.
All right. Sean Bailey.
Hello, Sean Bailey, Senior Transportation Planner with the Old Colony Planning Council.
Thank you. Travis.
Hey, good afternoon. Travis Pollock, Metropolitan Area Planning Council.
All right. Maria.
Hi, everyone. Maria Foster with the Brookline Council on Aging.
All right. And Shona.
Hi, everyone. Shona Norman, Transit Program and Compliance Manager at CADA.
Thank you. Andrew.
Andrew Jennings, Billerica representative on Lowell Regional Transit Authority's board.
Welcome. Tyler. All right, we'll come back to you there, Tyler, and hopefully you'll be able to unmute in a minute. Howard.
I am Howard Ostroff. I'm with the Dedham Active Transportation Working Group.
All right, welcome. Charles.
Good afternoon. I'm Charles Kilmer with the Old Colony Planning Council.
Thank you. Abby.
Abby Swain with Brookline Commission on Disability. I'm not really on it, but I just follow it, and also the Greater Boston chapter of United Spine.
Thank you, Abby. One second, please. My screen rearranged itself here. Erin Stevens.
Erin Stevens, I'm with the Town of Concord.
Thank you. Frida.
Yeah, I'm here. I'm Frida Wiley. I'm with Human Rights City, Boston and beyond, and with Amnesty International.
All right. Welcome. Len.
Hi, Len Diggins, use the He series, and I'm here with the Advisory Council, Regional Transportation Advisory Council, representing the MBTA Rider Oversight Committee.
Welcome, Len. And let's go back to Tyler. Can you hear us?
Yes, I was having trouble unmuting myself, sorry. My name is Tyler Sharacy. I'm the Grant Support Coordinator at the MWRTA.
All right. And have I missed anybody? I know a couple people come in while I was going through. So if you came in while I was doing the introductions, please unmute and introduce yourself.
Jesse Gordon from Randolph Town Council.
All right. Anyone else?
I believe that Christine may have joined as well during intros.
Hi everyone, Christine Medor, Mass Housing Partnership.
Welcome. Welcome. All right, and welcome everybody. Thank you for coming out on this and spending your this beautiful afternoon on Zoom instead of outside. And so now that we all, sorry, I accidentally muted myself. Now that we've all introduced ourselves, I'm actually going to hand it over to Vera Crane and Lisa Weber from the Executive Office of Health and Human Services, who are going to talk a little bit about the Masshealth Transportation Benefit, otherwise known as the PT1 program. So Lisa and Vera, all yours, and let us know when you'd like us to advance to the next slide.
Thanks, everyone. So I'm Lisa, and I will start off. Next slide, please. And just to give a brief introduction of myself, because I always say I'm the same Lisa, no matter what hour of the day it is. My other affiliations, when I'm not at HST, I might know some of you from Women's Transportation Seminar, Young Professionals in Transportation, or the Alston Brighton Health Collaborative, as well as MassAdapt. So we're here today in the HST role to talk about who we are, what we do, and what we don't do. So what is the Human Service Transportation Office? We are a state agency that oversees transportation services for 6 other state agencies. Most of these are Masshealth trips, and they have their own set of rules. And so we're going to focus on that today. What is Masshealth Transportation? And that's the PT1 program. And I think that's probably the one that if somebody has heard of our office or what we do, oftentimes we'll hear, oh yeah, I've heard PT1. I didn't know what that is. So that's what we're here to talk about. It stands for Provider Request for Transportation. And it's for when a Masshealth member can't get to a Masshealth covered service, a Masshealth provider submits a transportation request online. I'm going to say Masshealth 47 times during this presentation because it's important. It's really specific for a specific population. And the Masshealth provider must attest that the member does not have access to or cannot use public transportation. Who is eligible for PT1 transportation? There's 3 categories of Masshealth members, and that's Standard, Common Health, and Care Plus, specifically who are going to Masshealth covered services. So they can't use this service to go to services that are not Masshealth, and I'll mention that briefly in a moment. Who provides the actual trips? We have 2 brokers currently that coordinate trips across the state, and they contract with vendors who are transportation companies to provide the trips. At this time, there's about 400 different vendors and thousands of drivers. What is PT1 not? I get a lot of questions about this, so I just wanted to clarify who we're not. We're not paratransit. We're not the same as the ride. We're not for employment transportation, not for social or recreational transportation, not for anyone who isn't a Masshealth member, and not for medical services that aren't covered by Masshealth. And so we specifically kept this overview brief. Sandy has for distribution, some fact sheets about our program. I will also put a link in the chat momentarily about the task force I'm about to mention. We really wanted this to be a question and answer, a conversation. The program is covered by a lot of laws and rules. It can get really detailed, really complicated. So we wanted to give a basic overview of what it is. And we also wanted to tell you about some related topics. For individuals who contact our office who are not eligible for PT1, we will often direct that inquiry over to Mass Mobility and my coworker, Rachel Fichtenbaum, who may be on this call, may not be, but I know she's involved in a lot of these. And that's resources for individuals who are not eligible for our services. And one of those resources is called Ride Match, which is designed to be a database for transportation services. So whoever you are, whatever your circumstance, you can type in your specific information into Mass Ride Match, and it will come up with options. And the more we can add to that, the better. Non-Emergency Human Service Transportation Task Force. So this is pretty new. This just started in July. This is a task force that oversees us. And I promised I would only put one link in the chat. That's the only link I'm going to put in the chat. But that has information about when the meetings are, all of the materials, more in-depth PowerPoints about who we are and what we do. So I'll put that in the chat as soon as I'm done talking. And I also wanted to mention the Masshealth personal reimbursement, because that has to do with public transportation and is going to link to the work that a lot of you do. And I'm going to look to Vera to talk about that and to add anything or correct me or anything that you want to say that I didn't say, but I think I did a decent job keeping the intro brief. And I will now turn it over to Vera to talk about the Masshealth personal reimbursement and anything else that you would like to talk about.
Vera, you are muted.
Thank you. Okay, sorry. Thank you. Lisa, that was pretty awesome. You covered everything. I will just add that when we, at the front, when we mentioned HST handles transportation for several different agencies, the majority is Masshealth. The rest works a little bit differently, but you have to be an active consumer of one of those agencies going to one of their programs, which is why we're not really talking about it. Masshealth does have a personal reimbursement benefit that is limited to public transportation. So this is when people can use public, but might not be able to afford to use it. It's done on a reimbursement basis. They can get either reimbursed for a pass or for several fares. Their doctor submits paperwork, or they submit paperwork that their doctor has signed off on saying that they did come on such and such dates. And we use mapping software to verify that they can actually access public, that it's, within the guidelines. They send us receipts. We send them a check, and that's pretty much how it works. It's not a very well publicized benefit, and it's also not a heavily utilized benefit, because for the most part, we have found that people who are on Masshealth and are accustomed to using public transportation just use it as a matter of course and don't seek out any additional benefit. But in case you guys come upon someone who talks about the pinch, the cost of public, that is an option for them if they're going to a Masshealth covered service and they are a Masshealth member. That's all I got. Lisa covered everything, guys.
Lisa, did you want to add anything more? And thank you.
No, that was great. I'm very interested to see how all of this overlaps, which is on your next slide, how all of this overlaps with the work that everybody else in this meeting is doing.
Yeah, so thank you. So I would like to open it up for discussion. And this is kind of a very informal discussion. Folks can raise their hands. That is with Zoom. I can't see you necessarily if you physically raise your hand, or you can just unmute yourself to ask a question. You should feel free to ask questions directly to Lisa and Vera. We have some prompts here on the screen. Question one, how does the PT1 program fit into the landscape of other transportation options, which I feel like Lisa and Vera did a pretty good job of addressing. Then I think a much bigger question, what can we do to enhance coordination between PT1 and other ways of providing medical and human services transportation? And how can we make sure people needing to access transportation know which services they can use when? And then we also have a few other questions that folks submitted before the meeting, but I think we can start here. And I see Susan has raised her hand, so let's start with you, Susan.
Thank you. I'm really excited about today's topic. So I have a number of things because I think it is the coordination, as many of you know, it's something I'm really interested in. We have so many different transportation services which only serve very specific demographics or purposes, which then leaves so many gaps for other folks. So definitely wondering, in the course of today's conversation, what we can do to kind of break down some of those barriers and also not have the duplication of services. Additionally, I was wondering, do you know if there's a way, I don't know if your office would work on this or what we could even do legislatively to get health insurers, so other health insurers, you're working with Masshealth, but other health insurers to pay for trips to medical appointments. I think that would be really helpful and help us to get more funding, it would seem, for other types of transportation trips. And then I was also wondering, hearing you talk about this Masshealth reimbursement, which I was not aware of, so thank you. That just seems so complicated. I appreciate it exists. And I'm just wondering, is there a way that your office can help advocate to reduce fares for lower income people instead of having to make people go through this hassle? And I'll leave it at that. Thank you.
So it's important to remember that Masshealth is fundamentally a health insurance program. It's a public health insurance program. So where a PT1 is fundamentally a prior authorization, so we get, the online submission from a doctor. It used to be a paper submission. They would mail it in or fax it. Giving us all the information. We verify eligibility. We verify that the provider is real. We verify that the place that they're going to is a provider. All of that stuff happens, and then we approve it. So if you apply that concept to a reimbursement model, where what we've simplified it down to is what I explained, where medical providers are actually not new to that process, and ones that. This used to be a broader reimbursement. We used to reimburse for mileage as well. We don't do that anymore. But at the time, it was all the same. As long as a physician was willing to verify that the person actually had trips and had appointments, we would map, because we have the software, from point A to point B for mileage, or does public exist, and then we'd reimburse for public. The only thing that the member really has to think about is getting a physician to sign off and say, yeah, John Smith really did see me on March 3rd and 5th and 7th. The one caveat is we don't reimburse for less than $5 at a time. So Masshealth members can submit for up to 90 days worth of reimbursement. But is there a way to further simplify it? No, the public sector really, really likes its checks and balances.
I actually have a follow-up question. I'm going to take facilitator's privilege here. Two questions, actually. First, when you need the doctor's office to verify, does the doctor themselves have to verify, or does it just anybody in the admin side of the office?
It's the doctor, quote unquote, but it's usually front office staff that have the ability to sign off. And it's for the offices that have people that have a number of people who access this benefit, they have a pretty streamlined process in place. Like back when we did mileage, and this was a more commonly used benefit, we had some facilities where people came frequently, say along the lines of dialysis or substance abuse, and they would just print calendars, and they would put the physician's name, the member's name, and circle all the dates on the calendar that the person came, and send that in to us. So that is okay too. As long as we have something letting us know that, yeah, it really happened, the Masshealth provider is telling us it really happened, then we're good. We can always check on the back end after they bill, but that just makes it a cumbersome and slow process.
Right.
And then we're relying on them to bill us before we get to the whole thing. Right.
And then I guess my second question is a very technical one, which is what software do you use for route planning and trip, figure out whether a trip is eligible for public transit or can practically be done by public transit?
There's two different ones, but I'll look at Vera if you want to answer that part first.
If you look at Vera, I'm looking real confused. So this is all you.
Oh. So there's two different ones. The Masshealth Customer Service Center, which it's a company called Maximus, and they're the ones who adjudicate or auto adjudicate the PT1s, and there's a specific software for that. I know the company is called Maximus. I cannot remember the name of the software they use. What the doctors or Masshealth providers need to fill out to request a PT1 is called the customer web portal. So it's the same company that manages the customer web portal as well as the adjudication software. That is different than the software that actually assigns trips, and that's a company called HBSS. I cannot remember what that stands for, but I know they do a lot of work with other transit agencies.
Thank you. Yeah. I was just interested in that question compared to, what other transit agencies use and such, or whether you're just using Google Maps.
Sometimes. The Google API has messed us up more than once. So yes, that is a thing too. When you kind of to dig a little bit deeper into your question though, if someone sends us a PT1, we do automatically screen if they can access public transit, but the submitting physician has the ability to let us know a person can't access, is not suitable for traveling, whether it's because they have a physical disability or a mental disability, or they are behaviorally not a good fit. So that's all in there. Otherwise, if they don't fill that section out, we will screen and we will deny a PT1 for public because we are the payer of last resort. If public is an option, they should take public. And then of course, if it's a financial pinch, they can get reimbursement. But no, we do not flag that up front.
Who's this?
And I
Thank
just
you.
wanted to point out as a presenter privilege jumping in, we don't question that. And it's one of the few areas that I know of where we don't question what the physician says. If they say somebody can't use transit, that's it. We need them to say that, and it'll flag if they accidentally leave that off of the PT1. But it's between the member and their medical providers if they can't use public transportation. So I just wanted to point that out.
Yeah, thank you. Lots of extra details. I really appreciate that. So I just want to point folks to the chat where there's a discussion going on about different kinds of discounts to transit fares, fixed route transit fares. And I see Susan has her hand up again. So go ahead, Susan.
Oh, well, if somebody else has their hand up, please let them jump in.
You are currently the only one.
I'm the only one. All right. Okay. So I'm just wondering, and maybe this isn't the room for this conversation, but I've seen other programs like Access Pittsburgh, which from my understanding, they pool all the different types of transportation programs kind of into one pot. And then they reimburse based on whoever the ride is for. So if it's an ADA ride, that would come out of the ADA pot. If it's a PT1, it would come out of the PT1 pot. If it's a member of the general public who just can't take transit for whatever reason, maybe it doesn't exist, it comes out of that pot, or they pay on their own. If it's coming out of Council on Aging, it would come from those funds. What are the chances, or what do you think it would take for us to get to something like that? Because I do worry about how complicated we make finding transportation for some of our most vulnerable people. Thank you.
I don't think we can, either logistically or legally, because it's so specific who's eligible for PT1. And in order to work for us, there's a set of contracts, performance standards. I think all of those links are in that the non-emergency human service transportation task force. I think all of those documents are there. I know they're all public. I can post links to them directly if you like. But it takes a lot to become a vendor for us. So we're legally not allowed to have anybody who isn't one of our vendors prescribe or fulfill the trips that is requested under a PT1. So I love the idea on a general level or a conceptual level, but legally or logistically, even the way that HBSS is set up and how the vendors accept and perform the trips, it's now web-based, it's app-based. All of our vendors have to have supplier apps The drivers have driver apps. So trying to get all of those different softwares to talk to each other, even if it was legal, I don't think it's physical. So
So
yeah,
this
I
might
love
be-
the idea. I just don't know how that would happen.
Is this something your task force might be open to having discussions on?
I think they're willing to discuss anything that's pertinent to this topic. My opinion, and it is only that, is I just don't see how we would do it. Just if somebody was going to provide a PT1 trip, they legally are not allowed to without going through this specific process. So what I would say is if there's other vendors, we're always looking for transportation companies and have them sign up and contract with the broker so they can provide the trips as well. And then you can have continuity. There is merit to somebody having the same driver over and over again, or a company they're familiar with. So we can't promise that kind of thing, but when it can happen, there's a lot of merit to it. And it's just different. When I used to volunteer for the ride, and we had 3 vendors, and now, for the HST office, it's hundreds of vendors. So the things that can make one program work might not be able to make another program work. But I guess a more legal answer might be, if there is a way to fit it into the contract requirements, then it's on the table for discussion.
I think, it's important to remember Masshealth is a state and federal program, and we do have guidelines around. We have HIPAA to consider. So we need to know who is the person, what is their Masshealth ID number, where are they going? We have about 9 different coverage types under Masshealth. Only 3 are eligible for this benefit. The rest are on their own to get where they're going. And the Human Service Transportation Office itself is actually a coordination project, the intent of which is actually the subject of this discussion. We were trying to reduce any overlap and remove any inefficiencies, but under the Health and Human Services umbrella. So we also serve DPH early intervention. We serve DDS programs, DDS day hub though. We have a subset of our program-based transportation going to their work programs. That's funded by DDS. Early intervention is funded by Masshealth if the kids are Masshealth members, and by DPH if they're not. We do Mass Rehab Commission. We do Department of Mental Health. So we have little pockets where we really try to carve out how to streamline things. And it is possible for one person to have a PT1 for their doctor's appointment and also be on program-based transportation through DDS to get to their work program. But what that does not hit is the people you serve that are not Masshealth members. Is there a way to merge those? Not that I have figured out yet in the 20 years I've been here, but we are open to ideas.
All right. I want to come back to this in a moment. Oh, Vera, sorry, did you have one more thing?
I was just going to say the one merge where we have is that reimbursement for eligible members for public transit. But, if you guys have ever dealt with Rachel Fichtenbaum, she is in our office specifically to deal with the concerns of people who do not have Masshealth, who don't qualify for our other programs. But yes, you were going to say, Sandy.
Yes, I was going to say, I want to come back to put a pin in this and come back to it in a moment. I want to just point folks to the chat. A couple of questions there, and then we'll go to Abby, who has her hand up. Todd asked, does HSC have the capacity to take on extra transportation coordination for a fee from private insurance providers? Is that allowed under your state or federal funding provided? And then Susan asked, how do we know if some PT1 eligible people aren't taking the ride or paratransit? It would seem that we would want to make sure funding could go to the ride or other paratransit if people are using that service over using PT1.
Okay, so to address Todd's question first, do we have the capacity to add coordination? We do. We can absorb other programs. I am not sure from a regulatory perspective if we can combine private insurance with the public insurance, because we are the state doing this coordination. So theoretically we could. I just don't know if we're allowed to. But the bigger question there is, with Masshealth being an entitlement program where the non-emergency transportation benefit is fundamentally a question of access. If someone is on an entitlement program that gives them access to health insurance, we feel and the feds feel it is our role to help them get there if they can't get there. Unfortunately, private health insurance does not always take the same approach with regard to people being entitled to their services that they're paying for. So I think that that is a more cultural question and also a cost-based question. Do they want to allocate money to getting people to the services? It's private health insurance. I don't know. Sandy, I'm a goober and I can't figure out the chat. What was the other question?
The other question was from Susan about whether there are people who are eligible for PT1 but might otherwise take the ride or paratransit, and that we could, or who are taking the ride or paratransit, and wanting to make sure that funding is going to the ride or other paratransit providers, because the ride doesn't serve the whole MPO region or all of Eastern Massachusetts if people are using that rather than using PT1. I guess trying to make sure that money is flowing to the correct places and the most sustainable services.
So I want to jump in on this one, and I'm going to wax poetic for a moment. What I envision isn't pooling those, it's being able to say there might be somebody who takes PT1 to get to a doctor's appointment, but then takes the ride to get to their, let's say, 3 days a week employment, and then maybe uses fixed route if they're visiting somebody, or maybe uses a different service, and to make it more person focused. And I'm kind of wearing my advocacy hat when I say that, is that transportation is ultimately about people. And in the transportation community, we can get very siloed. And what I would love to see increase and continue is not necessarily pool all the money together or even pool all the resources together, but make sure we have a way to get the information, what those resources are, to the people who need them. And that's going to change. Somebody who uses PT1 to get to an optometrist, that's probably a bad example. Imagine that I said an example of a medical appointment that's maybe temporary, that you don't need to do, because hopefully you go back to your eye doctor. But if there's some kind of, let's say, surgery or something like that, you may use PT1 for that. You may not have that same kind of surgery, but you may need to get to employment and you're in a situation where you're not driving. So that's more what I think about, is having a way to get the information to the people who will use it, but not necessarily pool all of the resources together.
If I can add to that also, there are some people who will choose to take the ride over utilizing our benefit because they either don't know about it or they have used it and they didn't like it. We've been around for a while. We've had our share of challenges as this program has ramped up and developed. And there are some people who have dropped off along the way because at the time they decided they didn't like us. That's okay, it happens. So let's say one of our people has fallen off and decided they like the ride better. You could let them know. We can always, Masshealth isn't really so much in the business of advertising the benefit. It's just not a big thing that they do, but it is theoretically possible. Now, if someone decided they no longer wanted to travel through us, but we're seeking reimbursement, it's important to understand we can't reimburse you at your cost for paratransit. We can reimburse the fare. So whatever that person is paying, that's the reimbursable amount. And that's just the way it's set up. And we have explored this question over the years, actually, between DOT and Masshealth. There is no way for us to get around that barrier. Masshealth is deliberately set up so that any reimbursement is for whatever the cost is that you're charging the public. Or mileage, in which case, for example, back when we did mileage, a Masshealth member would get the same mileage reimbursement any of us in the public sector get. So it's all about keeping things equal.
Yeah, thank you. So Abby's had her hand up for a while, so let's go to Abby. And then I want to come back to this, as I said before. So.
Yeah, no problem. This is very interesting. I'm not impatient at all about this. I have been surprised at the extent to which folks with spinal cord injuries who use wheelchairs, et cetera, have defaulted to the ride instead of PT1 for all their needs, including going to Masshealth medical appointments. And some of the more savvy members of the Greater Boston Chapter of United Spinal have spoken up and counseled other folks who participate in support groups, et cetera, to give PT1 a try because they feel like it offers superior service. I've also been surprised at how few people know about Ride Match and how wonderful it is. I've tested it for different folks who are kind of new to the world of disability and maybe a little bit outside the MBTA catchment area. And it really seems quite versatile and sound. And I just, I wonder how to, and this is following up, I think, on Susan's point, how to make these options more visible. Do we need to do outreach to caseworkers at hospitals and rehab institutions, nursing homes? How do you do that outreach and advertising? And maybe we could help you do some more.
So nursing homes, we've got that covered actually. And although I'm curious if you guys see a lot of people from nursing homes seeking out the ride, we have been working on rolling out an enhanced chair car service, taking Masshealth fee-for-service vehicles that are presently scheduled directly under the HST and primarily with the goal of expanding the vendor pool and assisting them in expanding their fleets. So that's nursing homes. Lisa, want to jump in with any of it?
In my dream world, anybody could get anywhere in the entire state and not drive a personal car for whatever reason. That's kind of my dream world. And we're working on that. The best thing I can think of in addition to increasing the information about Ride Match is exactly like you said, community engagement, getting the word out there, at least be able to get the information to people, which sometimes requires a conversation, which I have the two, I'm arguing with myself about this because sometimes, and I will get inquiries and anybody is welcome to call our hotline at any time or email our email at any time. Sometimes it does take a conversation and say, no, actually they're asking about employment, or let me not ask about employment yet because I realize I'm going for surgery next week. That's why I keep coming back to person focus. So I think the more of us that can learn about these options, no matter what they are, and with the understanding that none of us is going to be a 100% expert, believe me, I try, on every possible transportation related topic in the entirety of the state. I just think the more of us that know about as many options as we can, and as many of us get information into Ride Match so that we know at least that's a database. And I will happily stay on the phone with somebody if they want to give me their general information and type that into Ride Match and go over those options. And I do send a lot of referrals to Rachel, who knows way more about the other transit authorities. I'm more primarily familiar with the MBTA.
On the subject of how to get the word out better, Masshealth doesn't really advertise a whole lot. It's just kind of part of the public sector idea around these sort of benefits. And, none of us really want to be on Fox News, but we do welcome social workers talking about this, community-based information, word of mouth. It's really important. We can't necessarily advertise. We have tried to make our website more robust, and we have tried to put on more frequently asked questions and tried to make it more accessible to people. But yeah, spread the word, let them know it's here. Again, not every single person with Masshealth, they have to be eligible. But as I always tell people, there is no harm in asking for a PT1, trying to get a reimbursement. The worst thing that's going to happen is you get denied and then you're no worse off than you were to begin with. But the best thing is you find out you were eligible and you can access the benefit.
Great. Thank you.
Mm-hmm.
No, thank you. So I wanted to follow up on something that Lisa said before, because it reminded me of other work that I'm doing at the moment also, which is we at CTPS are supporting the MBTA and exploring what they're calling mobility integrations, basically looking at how they can partner with other providers in the region in various ways, fares, schedules, infrastructure. advertising, that kind of thing. And one form of that, the most kind of maximalist form of integration, is what's known as mobility as a service, or MaaS. And it sounds, Lisa, like what you're describing as the ideal world is something very similar to this concept of mobility as a service, except that it's a kind of a personal travel wallet, as I've heard the phrase used, that includes human services transportation. And obviously there's going to be complications in that, because this is often a very digital concept that's not going to be accessible to everyone. But it seems like that does, in an ideal world, that should be where this is all going. And that basically somebody should be able to say, I have this trip, and on the back end, it gets processed. What's the best bureaucratic process to pay for it and facilitate it, and that they just don't have to think about any of that to the maximum extent possible. So a question I get, for Lisa and Vera, though I understand that there may be limitations on what you're able to address, but also for the rest of the crowd here is, who's advocating for something like that, something that really is about universal access. What are the pathways to making something like that happen? Because this is something that we've been hearing about in all of these coffee chats we're doing on human services transportation, something we hear about at the MPO all the time and all of our transit working group meetings. And it is fundamentally, right, it's almost a political need more than a technical one. So I guess I'm interested in hearing if anybody's got experience advocating for this or fighting for that kind of thing.
To add to those thoughts, some of the options I'm realizing are municipal. I think a few of us were just in the presentation earlier where individuals had to be Newton residents to use that service. So any particular municipality might have their own options. People might have options based on age. People might have options based on disability status. People might have options for any income-based reasons. There's just any number of factors that could make one service eligible and that same service not eligible to different people. So it's still, I think for me, it just always comes back to information and referral. The more easily accessible the information is, because to me, it's two different things. It's how do we get information out there about services that exist, and how do we improve and increase those services? And that's kind of two different questions. So I always welcome ideas. I joined the HST team partly for community engagement and getting the word out and coming up with new options. So at this point, that's probably my best answer.
All right, I see Len has his hand up.
Thank you, Sandy. I think you're right, Sandy. I mean, we have to figure out how to create the political will to change things. Because you can make the information accessible as much as you can. But there's just so much information out there. And people just aren't going to be aware of it and thinking about the people who are using these services. I mean, especially when they are doing medical appointments, it's just a stressful environment for folks. And they're just going to do what they have been doing because that's what they know. And they don't even know what they don't know. And so, one temporary solution, but probably we don't have the person power for it, is to inform their caretakers, so that they can help them navigate or do the work for them. But that's just getting a person to do that back end work. But developing the political will requires making the lawmakers aware of this issue, and bringing it to their attention and going, we need to make this more coordinated or make it more universal. And I know there are lots of lawmakers who welcome the opportunity, welcome the issue, and look forward to working on it. It's not to say that will happen in the next session, but just get it to their attention. And so now it's a little more in my attention. And so I know some lawmakers that want to work with me, but I think it'd be helpful to bring something more coherent to them, or more developed to them, rather than just an idea. So I look forward to working with you all to try to develop something to bring to the lawmakers who I know on Beacon Hill that would be in favor of trying to develop something that is closer to MaaS. Thanks.
Yeah, thank you, Len. And for those who don't know him, in addition to wearing a bunch of other hats, Len is a select person in Arlington. So he knows a little bit about the electoral process. Len, I really like the idea that you brought up of reaching out to caretakers and educating caretakers. I think that's critically important population. And it can be linked to all kinds of other education efforts for that those workers as well. Susan?
Thank you for letting me speak again. First off, I do want to say to Lisa and Vera, I do appreciate everything the HST office does. And I think we're probably all on the same boat of wanting to just make sure that people get the service that they truly need and can get where they need to go. And so in regards to the information and referral, that is an important part. And that's something we do all the time here. And it's just, it can be so much. You give them a toolbox and it's just so much. Even like, I love Ride Match, I really do. It's just, even then you can see people, their eyes glazing over. They just want to know the thing. Just give me that number that I can call, not the laundry list of I have to use this service for this and this service for that. So like where you mentioned, like in Newton, only some people could use some services. I think all of us have that issue, right? And there's just so many of those services that only some people can use. So it's really about what can we do and how can we help you? Even though there may be these legal and other challenges, how can we help you so that we all can make a service, make transportation just easier to navigate? And then that leaves me with a question for Sandy. I don't know, would this group ever invite in like some of our legislators, or you guys do like a legislative breakfast, or?
MAPC does. I'm sure we'd be happy to partner with them to help bring it on the agenda for that, or we could certainly think about having some legislators on the agenda for one of the coffee chats, or even at one of the working group meetings. Certainly, I intend to have a little bit of a conversation about future agenda items for the working group at the next quarterly meeting, which will probably be in May. So we can think about putting this, bringing that up as part of the discussion there.
I mean, I admit I don't know what all the legal challenges are, but I can imagine, as Lisa said, they are probably numerous and very complicated. And just looking for ways to make things easier for people. Thank you.
Yeah, I mean, it has to do with funding sources and with regulations and and HIPAA, things like this that usually create barriers when it comes to integrating any sort of trips or information sharing. But I think, for example, as far as notifying caretakers and other people that might be able to direct a person who is eligible for Masshealth transportation, one of the things that we have on paratransit is we're not restricted to any geographic area. We will take you across the state. Sometimes we'll even take you over the border if that's where your doctor is. We just need to have a justification, and where it sounds complex, it's actually so simple that it trips up most providers. I don't need to know the diagnosis. Just tell me why you want to go to the further away doctor. Like, is the closer one not taking patients, or do you just not like him? Do you have a relationship out there? It's so simple, it really messes people up, but it's important that people know you don't have to forego seeing a faraway doctor or a faraway specialist just because public transit won't take you there. If you have Masshealth, we will take you there. And unfortunately, it is really limited to, in this case, Masshealth appointments. Would that we could share this service with everybody else to get them where they need to go? Unfortunately, we can't, and we don't have the vehicles either.
All right, so we have 10 minutes left. Any further questions? I have learned a lot. My head is spinning a little bit, to be perfectly honest. But I feel like I'm starting to get a much better grasp on all of this. So thank you, Lisa and Vera. Yeah.
I have one more quick question.
Go ahead, Len.
So how are you all? What are discussions are you having regarding the next LRTP? Because I became aware of you during the last cycle of the long range transportation plan, because there's your plan, which kind of rides under the radar with respect to the development of the LRTP. So I said this next cycle I'm going to really pay attention to you. So what's going on with respect to your discussions for the next long range transportation plan?
Yeah, so the MPO's long-range transportation plan, as you know, Len, is in development, right, and will be endorsed hopefully next year. We also prepare the Coordinated Public Transit Human Services Transportation Plan, The last one of those was prepared in 2019. And Betsy Harvey, who I think is here, was our lead on that. And that's really focuses very specifically on this question of the interface between public transit and human services and elder and medical transportation. But one of the things we do for the long range plan is a very large, what we call a needs assessment. And so, you know, what we hear at these meetings and what we hear in every other venue where we're doing outreach or just talking to folks does make it into that needs assessment. And then the part of the goal of the plan is to lay out, you know, the strategic high level objectives for meeting those needs. Betsy, did you want to say anything more?
Yeah, I mean, Sandy pretty much covered it. We do try to align the coordinated plan with long range plans, so they're done at the same time, so that the needs that we hear for the long range plan needs assessment also go into the coordinated plan. So all of this is not going into a vault. It will be, you know, part of our coordinated plan that is developed probably next year. Is, you know, since our long range plan will be to finish next year, that will be this approximately the same timeline for the coordinated plan.
So could this, like, I'm sorry, please continue, Betsy.
No, go ahead. Go ahead.
I was just gonna say, so could this be this notion of mobility as a service, be like that? I'm hearing it as a need, you know, or at least a desire, you know. Would that be something that we could say that we would aim for in the next LRTP or the one after that?
That would be up to the MPO. When whatever, right? When I'm sure the discussions will start to ramp up this, you know, in the summer as we near kind of the 1 year out from the plan approval, around kind of the goals and objectives and the things that we want to achieve through the long range plan. So if you support mobility as a service, that could, you know, certainly bring that up during the meetings.
Well, and the question really was, is it a reasonable ask? I mean, so, you know, we can ask anything, but we want to ask reasonable things. I mean, and things that or that we get stepping stones to the ideal. So that's it. I mean, thanks as always. Appreciate it.
Well, yeah, and I think, you know, now that the need has been clearly expressed, that, you know, the MPO certainly can have that conversation about the best ways to address it. You know, as Lisa and Vera have talked about it, PT1 is a statewide program, and I suspect that there will be momentum for any solutions to be statewide as well, rather than governed by, you know, say MPO boundaries. But I know I personally would love to see this discussed at the MPO as well. Any further questions? All right, and Lisa and Vera, if you guys could put your emails in the chat so that we can, so that folks can follow up with you if that's all right. And then I will, of course, have mine available as well. So Matt, if we could go to the next slide. Just wanted to share a couple more things that are coming, and really thank you to our guests, to Vera and to Lisa today. This has been really informative. I have learned a lot. I'm sure others have as well. It's been a very interesting discussion. I just wanted to put in a plug for one more event that is coming up, another coffee chat that is on April 6th, and I'm putting the registration link in the chat, which is about basically the challenge that various transit agencies and other mobility providers are having finding drivers. It is a tight labor market, and it is, you know, been very difficult to hire enough folks to keep service going in many circumstances. Luckily, the Federal Transit Administration has just spun up with their Transit Workforce Center, really just a few months old, and they are going to come out and help facilitate a discussion about developing strategies for finding enough drivers. And you can sign up at the Zoom link that I just put in the chat, and hopefully we'll be announcing more coming soon. I think you all know where to find me, but just in case, my email's on the slide here, sjohnston with a T at ctps.org, or on the phone 857-702-3710. So with that, again, thank you everybody for coming out. Go enjoy the beautiful evening. It is starting to be spring, and we'll all be in touch. Take care.
Thank you.
Bye-bye. Thanks. Great.
Thank you.